This
eyes,
conference will now be recorded.
and no, you can't see any signs of help. You can't see the shore. Well, 6 students committed suicide over the last year, and after discussions with His Excellency Ajay Bisaria, the Canada-India Global Foundation, of which I'm the national president, we have chapters in Montreal, Ottawa, Toronto, BC, and Alberta, decided to get involved to try and present a solution for this. And Sahyog was formed. And what Sahyog wants to do is we want to be able to throw that student who's surrounded by these waves a lifeline and show them that there's a way out of these problems. There's a way to find solutions to that by making accessible to them support groups in the community and also providing access to the provincial health services. So I don't want to take much of your time. I really want to thank His Excellency Ajay Bisaria and Professor Tyagi, Professor Amresh Shrivastava, who will be hearing later on, Shalini, Shraddha, Anjani, for making this possible. And I want to thank all of you. And I hope that after this webinar, you will become ambassadors of the group and let other people know that this group is there to help them. And it's, you know, we can only be effective if people know that we exist to help them and they contact us. So with that, no further ado, I'll turn it back to Rajesh.
Okay, thank you, Dr. Dwivedi. So I just want to give a little bit of context so people would have better understanding, and after that I would introduce His Excellency Ajay Bisaria ji. So before that, so the idea for Sahyog came in last few months, and based on the discussions with variety of students, I am with Dr. Dwivedi and other people, and especially during the time of COVID, like since March, it has become even more, you can say the need is even more. And so I heard the comments like, oh yeah, nobody told us that we are going to miss home so much before now we are in Canada, we are missing home, we are missing our food, family, and especially in the lockdown period, even the social, you can't really go to the temple, go to the other social or community related events. So that thing came and said, well, what should we do? There are some of these events have happened in different, whether it's University of Ottawa, or Concordia, or different places we are aware about. So we said, yeah, let's launch this. What should we do? Maybe we should have a survey of students. But my idea was, and the other people in the committee said, maybe before we do the survey, let's probably hear and then have a discussion or a forum to hear from people what is happening. And then before even that, well, we found Dr. Shrivastava, a well-known professional in this area. And then he became like the brain. What should we be talking about? Maybe there are 2-3 major issues we should be talking about. One is the awareness about mental health issues. And the other one is the stigma, especially in the Indian or the Desi community here. And it's true even in India. So we should be talking about those 2 issues. So we said, well, we should have a webinar, discuss that. So this webinar will be more structured. There will be, you could have questions and comments in the chat session, but followed by that, we will have another webinar in January. We will have the details later on, and will be more student discussion driven. So students will discuss their things, how, whatever their experience have been. So those things will be there. And then in the meantime, if we can have some structure within university college system, the social or other types of things, and those will be the other things. We will come back to some of these points later on. So in the interest of time now, I would like to move on to the next item in the agenda, which will be a few words from His Excellency, Mr. Ajay Bisaria. I would like to introduce him briefly. His Excellency Ajay Bisaria has been the High Commissioner of India to Canada since March 2020. You should underline the word March 2020. That's the time COVID lockdown started. So he's a career diplomat who has earlier served as High Commissioner of India to Pakistan and as Ambassador to Poland and Lithuania. He has represented India at the World Bank in Washington, D.C., and in embassies in Berlin and Moscow. He has served in various capacities in India in the Ministry of External Affairs, Department of Commerce, and the Prime Minister's Office. He has a bachelor's degree in economics, an MBA from IIM Calcutta, master's degree in public policy from Princeton University. His Excellency Ajay Bisaria.
Thank you very much. Thank you, Dr. Dwivedi, Mr. Rajesh Tyagi, Dr. Shrivastava, Ms. Nalini Toscano, and all our young friends who are tuning in. It's especially for them that we've put together this wonderful initiative. Well, let me start by commending Dr. Dwivedi and all other friends who've come together to promote this initiative of Sahyog or support for Indian students. This has been a long felt demand from the beginning of the year, a long felt need that we ought to have a support group of this nature. I think the context has been very well brought out by you. We have today 230,000 Indian citizens, Indian students, which is a very important community for India, because these are Indian citizens coming into Canada, and certainly for Canada, because this is high quality human resource, human capital coming into Canada. And as a Canadian leader recently told me, this is low hanging fruit for Canada, because many of our friends who are coming in as students are going to be potentially immigrants, are going to be workers, are going to be become Canadian citizens at some point of time. So these are people who are important to Canada and important to India. And hence, when we have these conversations, when I have these conversations with university presidents, for instance, we keep the interests of our students front and center, of those who are already in and those who are coming in. We've also this year has been especially a year of disruption. As you've mentioned, this year was not just because of COVID, but because of multiple global factors. And also, this is certainly when you're a youngster coming into a new environment, you're jumping into the deep end, and you're facing multiple shocks, including a cultural shock, including a shock in terms of the missing your parents, missing the food, and at multiple levels, it's a process of readjustment. So I think the fact of being able to reach out for help whenever you need it is something that is something we all need as students and as a very responsible Indo-Canadian community, which takes care of students in a sense of being their foster caregivers. In the High Commission and the consulates, we feel that we ought to be a home away from home for many of these students coming in, and that is what we try to be. I've been in touch with hundreds of parents and with students talking about their issues, talking about their problems. This year, we saw a sterling example of how the community got together to help the students in the initial shock of the pandemic. They wanted to go back home when the classes shut down and education institutions were shutting down. And that's the time we started the Vande Bharat mission. And as you know, Canada was one of the first countries from where we started these flights. Some of the first people using it, Indian citizens, were Indian students. So it was an example of us coming together, arranging in a policy sense these flights. In many cases, they had to be given documents, and also the community coming together and organizing immediate needs like food and so on. So one part of the whole jigsaw has certainly been the less talked about part, which is the mental health of these students. And I'm delighted that you are addressing this issue head on. We've had troubling news this year of some suicides, we come to know from friends of many students and others of the sudden mental health issues they face. And I think in many ways the first responders are the friends of these young people themselves, because they are the ones who are seeing their friends going through some trouble. And that's why I'm delighted that a large number of young folks have joined this seminar. So once again, let me commend you on this initiative, and let me assure you that we are with you to give any sort of support you would need for this initiative, for reaching out to students, and for the students themselves. We are with you. We hope that student leaders in every institution come together to support the community and to reach out to their friends who are in need of this specific kind of help. So thank you very much for putting it together, and all good wishes for the success of this initiative. Thank you.
Thank you, His Excellency, Mr. Ajay Bisaria. So as the message is very clear, it's like with the support from the High Commission office and it's not a one-off webinar we are thinking about. We would have more regular every month or every 2 months where we would have more participation from students, but it does not have to be at the national level every time. There may be a local, regional, and maybe at the university or college level, there are ambassadors, as was discussed. So if we can have that type of support structure in place, and with that in mind, I had also shared this webinar with the Shastri Indo-Canadian Institute. And I know there are many of them online, and they already have a structure in place for member representative at universities. Maybe the students will also be part of there could be something done there as well. Thank you. So with that in mind, I would move on to the next item in the agenda. That will be a short presentation by Dr. Amresh Shrivastava. Dr. Amresh Shrivastava, he's a professor emeritus in the university, a trained psychiatrist from KEM Hospital, University of Mumbai. He obtained fellowship from the Royal College of Psychiatry, UK, FRCP, and he was accorded with FRCPC in Canada and fellow of the American Psychiatric Association. Dr. Shrivastava, his professional background spans over 40 years in mental health. During his experience, he has worked from various countries. It's in India, Canada, UK, and others. Dr. Shrivastava has authored a number of publications and 5-volume textbook entitled Suicide from a Global Perspective. He firmly believes that education empowers. This is what we are here for. Education empowers. Knowledge translation in the field of mental health is his lifelong struggle to respond to the complex challenge of stigma, unawareness, and ignorance across all societies. So I would like to have Dr. Shrivastava say a few words here. Dr. Shrivastava will be now the next one to present.
His Excellency, Dr. Dwivedi and Rajesh, my friends, sisters and brothers in this webinar. I begin this with my condolence to the family and friends of those people who are not amongst us today. Having said that, we are reminded of our responsibilities and roles that we ought to play in this community. Mental health is important because without mental health, we cannot be healthy, even physical. Suicide prevention is one of the topic that is not only with the mental health, but it's across the span of all health professionals. Particularly, our young people are more vulnerable for this problem. A number of people who immigrate to any country, they come with high vulnerability and sensitivity for mental health issues. And let us not forget that when they transit from one country to another, they come with hope and aspiration. And when they feel stressed here and when they find themselves lonely, it's a matter of great concern that this community needs to extend support. And so my first thought to share with you is stigma. Stigma prevails not only with mental illness, but particularly with suicide behavior. And one of the difference is that when you treat a patient with mental diseases, the stigma reduces. However, for suicide behavior, even after good treatment, the stigma remains. So there needs to be some extra work and careful crafting of awareness programs, more dialogue, more discussion with families, friends, and parents, and to everyone in society, because it's a collaborative work. It's a multidisciplinary problem. Suicide is a personal tragedy. People see no option for life and then they attempt. Let me also share with you that it is not a disease. It is a manifestation of cultural, social, biological, and psychological problem. And finally, it has a role spirituality for a person who is going through the crisis. It takes a lot of resiliency to face the crisis of any personal nature. What I would like to share with you that when a person transits from one stage to another stage in life, whether it is marriage, promotion, migration, or job or transfer, they go through a transition of the phase. And the transition is always stressful, particularly for the students who come, they come with double transition. They are in an age where they are looking for more opportunities, they are more anxious, and they are undergoing a migration from one place to another. They are leaving their homes and coming to another country. So they are quite anxious, their stress tolerance goes down, their resiliency goes down, and they need to be connected. So the duty of this group, the roles and responsibility would be to establish better connection. Also, we need to remember that they need to live with dignity. Those people who have suicidal ideas or they have attempted, we need to be very sensitive and treat them with respect and not develop a sequential problem of mental health issues. Many of them sulk in depression after making an attempt. Depression is a treatable condition. It is very prevalent, maybe 20 to 25% in community and also in the students. Further, the suicidal ideas are prevalent in students. The various studies have shown that about 15 to 20% students at any given point of time live with suicidal ideas, and it just takes a stroke of stress factors due to which they make an attempt. And therefore, what is required is identification and early intervention. So the facilities for intervention have to be created in the community. We need to form a network. The community's participation really take this responsibility. And once a network is formed, each and every student will have access to connect. And if in any crisis, the student can be helped. Number of them develop substance abuse problem that needs to be looked into. And a significant number of students come who already have a psychiatric problem or mental health issues, but still they have taken a brave, bold step to come and explore newer possibilities in the country. We may have to collect some information so that we are ready to help them. The crisis services, hospitals, primary care support system all in place in this country. It's only a matter of reaching out and availing of the opportunities which is present. I think with this brief background, I will leave it open for discussion and would give it to the next speaker, and then we'll discuss the cases which are presented. Thank you very much.
Thank you, Dr. Shrivastava. So I have one or two clarifying questions. Some of them you mentioned points we could ask now, and then as we move on, I wanted to just raise the point. Number one is let's say people here, 50, whatever, 180 people, they are here attending there. There are some students who are closed in their room now, apartment, socially disconnected, or they are not much in socializing. How to engage them, how to get them out of that bubble or whatever that they have built in. What are the different ways? So the people who are here, we can help our friends or people, somebody else, their classmates. What are different techniques or methods? Or what would you suggest, or what would you tell them? We can't hear you. Yeah. Hello. No. Yeah.
Hi, everyone.
Dr. Shiva.
Shalini Toscano. Sorry.
Hold on. I think Dr. Shrivastava was answering the question. Could we have
sorry.
That?
Sorry about that.
Yeah. 1 second. Anjana, could you have the answer from Dr. Shrivastava? Hello?
Rajesh needs to unmute. Oh, there you go. Now we have it. Okay.
Yeah,
Can you hear me?
It's okay. Yes, we
So,
can hear you. Yes.
This country is very much different than what we know back home. And here, mental health laws are very much in place and they are very strict. Nobody can ask for help except the person himself. There are legal provisions, and if somebody is isolating for significant number of period, the only option we have is to call up the 911 and ask them to really look into this problem. Now, before that, it is important to recognize the risk factors. For example, if somebody has been showing isolation, behavior changes, or substance abuse, friends and relatives can discuss with them and take them to the college counselor and do further necessary things. And that is why my suggestion was that we should have a network of seniors and colleagues in the community who know the students and they are in touch on regular basis so that the serious problems does not arise. But if somebody has isolated for significant period of time, we have no other option but to really call the police, and then they will take up for an assessment in mental health and do every possible thing.
I have just one more question and then we will move on. My second question, because I got some messages from these are staff member and professionals at universities.
Right.
They are interfacing with these students. Okay. And sometimes they get the impression like these professionals they don't understand Indian culture very well. Indian cultural, especially whether our integrated families, there's somebody coming from village, those type of things. Some suggestions for these professionals to break that barrier or to break somebody, so engagement could start at the university level, even if they don't understand that well. But yes, I'm a professional. I can probably still can help you guide anything.
Yes, and your concern I can understand, but the system here is taking care of cultural aspects, and the practice is that when somebody is examined in the emergency room or in a psychiatric unit or in the crisis department, there is an option to bring the near and dear one who can make them aware. And let me also say that it's not really correct that they don't understand, because most of the counselor and the doctors and the nurses are aware about the cultural differences. In fact, they go through the courses in cultural psychiatry and they are fully trained about it. And the Asian community and Indian community is here since quite a long time. So I don't think this should be a major concern, but to some extent it is a concern, but that can be taken care of by the people in the community. Instead, family members, after we obtain consent of the student, we can discuss with any friends or relatives. Otherwise, if the consent is not there, it will be very difficult for the professional staff to connect and have any kind of discussion. So it is the responsibility of the student who goes into in the hospital that he should give a consent, as say that I have my relative or have my friend, and they need to discuss. After this consent is given, then the process will take over and the families can be contacted and discussed.
Definitely.
Is
Okay,
that clear?
Yes, perfect. Thank you. Yeah, so we will come back later on with you. Yeah, so now I would like to move on. Before I move on, just like there was a question on the chat saying we will address the resources available for student during the session. Yes, that is the intent for us to. What are the resources available, whether it's at a community level or whether it's at college level or at a different or a high commissioner level, all of that. We want to have one central place. This is our goal in that. So with that, we'll move on to Shalini, next one, Shalini Toscano. So if you could change the presenter to Shalini Anjana. Yeah. So the Shalini will discuss her story and her life. I have known Shalini for a few years. And when we were organizing different events in Montreal, she used to come and be part of it and help through that. So we would like to hear, are you there, Shalini? Are you the presenter now? Okay, all right. All right, so you could just take your time and then go ahead, it's yours.
Take two.
Yes. Yeah.
My name is Shalini Toscano. And this is the first time I'm speaking publicly about my husband's death and suicide. I've been doing mental health advocacy for about 2 years now since his death, starting from his funeral, where we had a few people address mental health, particularly in the Indian community. My sister-in-law, Andrea Cronus-Toscano, who's a professor at University of Maryland, took to the pulpit and spoke to everyone attending. I think we had over 300 people who were there. And from that point, because we were open about his death, the fact that it was a suicide and that he struggled with depression since he was a teenager. And Anand had attempted suicide when he was 20 years old. And so one of the indicators, as Dr. Shrivastava had mentioned, is that if someone has previously attempted suicide and they're in a stressful situation, there's a likeliness that they might do it again. And this was the case for Anand when he came to Canada. The first time he attempted suicide was when he was 20, and it was after receiving the results to his exams. And he scored a few marks less than his brother did, and his parents were absolutely devastated. And the way he described it was that it was like a funeral at his home. And neither of his parents asked him why he did it. And it's not a surprise because Indian parents generally don't talk about feelings. They brush things under the carpet and just hope things will go away. So when he arrived to Canada, he became very focused on getting a job. And what he didn't realize was that the immigrant experience is difficult. It's hard. It's hard to integrate into a new country. And when you come to North America with just immigration papers and not a job transfer or to study, you have to start from the bottom. And he took this quite hard. And after about a year, I noticed that he would become quite withdrawn at times. And so finally, I suggested going to a marriage counselor. So we had done that, tried it for a bit, but his depression got worse. And as a result of his depression, he did things that made things difficult for both of us. So I took him again to another counselor. But about in 2018, in June, he started talking about taking his own life. Actually, the year before that, when I took him for the marriage counseling, when we came home, he actually opened up to me and he said, if I die tomorrow, it wouldn't matter. And when I asked him, it scared me when he said that. And when I asked him why, he said, I don't have a job. I'm not doing anything. I feel useless. These were things that were told to him while he was growing up all the time, that he was useless, and it stayed with him. And so when he started a year later in June 2018 talking about taking his own life, I called the paramedics, I called our marriage counselor, I called the police, I called his family. But his family said that, he does this all the time. He's just trying to manipulate you, because his family in the States did not know, his brother did not know he attempted suicide before, because his parents never told him about it. So they were completely in the dark about his mental health history. On my family side, my brother, my cousin Johnny, my sister Elizabeth, we all tried to get him help. My cousin Johnny came over, tried to talk to him. He's a medical doctor, but he just wouldn't open up. And I honestly believe that had he got the go-ahead from his own family to get help, he would have. Because there was one time we were watching this television show, This Is Us, where the character Kevin took his entire family as an adult for a therapy session. And my husband turned to me and he's like, I want a therapy session like that with Ai and Sanju. That's his mother and brother. And he just felt, and I asked him, well, why don't you get some help? And he basically said, whenever I expressed my feelings before, they were always denied. So I feel like I have nowhere to go to. And so my whole advocacy now is mainly trying to address to people that it is necessary to talk about mental health. It's very essential, because it is the only way we will diminish the stigma. It's the only way we'll be able to understand what others who are suffering with any sort of mental illness are going through. And it's the only way we'll be able to understand, educate ourselves, and be able to support them as well. And what my hope with Sahyog is to create a space where it'll be a safe space for people to share their struggles. And I want the students, Indian students who are here right now, to understand that it takes strength to be vulnerable, and there's no shame in asking for help. And it doesn't matter. Log kya kenge does not matter. Helping and listening to others matter, and you matter.
I think,
Yes.
Mr. Rajesh, shall I continue to discuss?
Yes, please. Yeah, that's please. Yeah. Yours.
I think, Shalini, you are brave. It is extremely difficult to talk about near and dear one who has committed suicide. But I appreciate your commitment to the cause, that you have associated with this organization, and you are taking this movement forward. Let me throw some light on what was the problem. So a couple of risk factors that we need to remember. As I said, it is not always a mental illness, but a history of previous attempt of suicide, whether it is years back or 5 years back or 10 years back. It has been found that these people are at added risk, and about 50% of them make another attempt. The second, when people are unemployed or have social stress, their problems further increase. And to make the matter worse, that if the problem remains untreated, unattended, it is very unfortunate most of the time. So taking a lesson from what Shalini has spoken is that someone needs to talk in the family if there are risk factors like a mental illness, depression, substance abuse, or a previous attempt. One should be very careful and take it very seriously. Family members need to be educated, and that is why we say that even suicide prevention should be part of the teaching curriculum in the university. Unless that happens, we would not be able to train people, educate every student to give a right message. Our students today are going to be tomorrow's parents, and therefore their responsibility is much more. I suggest that more and more education, discussion amongst the group goes on so that they can identify any crisis amongst their friends, their children, their sisters, their brothers, and take a recourse for intervention. Let me finally say that the treatment is highly effective. Those people who face a crisis, they all become all right except a minuscule percentage of them who go on to attempt. And if treated, the transition from the stage of suicidal ideation to suicidal attempt and then further to suicide is very, very less. It's not very high. So there are positive things that it can be identified, it can be treated, and it's unfortunate that we do not know about it. And I think as time comes, more and more people will get involved and they'll take this movement forward. If there's any other question, I would address that.
All right. So what we wanted to have a little bit more discussion, like, and the understanding of these, you can say, the events from you, Dr. Shrivastava, like the people can see the symptoms, or the how people could understand, people who are not professionals, who the friends and the students, how they can become more aware on how they can, these are the markers. If we can have some of that a little bit more in detail, like the marker, what are the initial stage and where things have already gone so far, where it is already too late, or so what are the ones, and then we will come back more for suggestions, like what should we do. Like we have already talked about these networks. I want to go back to that question about network again. So
Okay.
what are the marker, and then the connecting it to the network later on, and what.
Right. So it's an important question that we need to really understand, that what happens before someone attempts suicide and how do we recognize. So let's remember that there are some preceding factors, and a common factor is a stressful event. So if somebody is going through a potential stress, for example, somebody failed in the examination and he's lonely, or someone has a significant amount of financial loan, or someone has become depressed on arrival, or they have lost contact with the community or with their family members back home, or if there is some crisis back home to which they cannot attend, or sometimes their financial matters become, they run out of money, or on many occasions they have also been known to spend money inappropriately. So these are some of the subtle markers and situations as far as a stressful situation is concerned. As far as symptoms, the commonest one is isolation or change in behavior. So in change in behavior, either someone isolates or they go and run around purposelessly in the city, remain stressed, indulge into alcohol or drugs or cannabis. So if there is a sudden change in behavior, so for example, somebody was not using cannabis and has started using cannabis much more than somebody would use in recreational uses. The friends, if they are aware that this is an abnormal pattern of substance abuse, I think it's a matter of caution. Or if somebody is starting to discontinue the school and not attending on a regular basis, that is another situation which should alert the friends and the teacher. So the basic thing is in the college, the friends are connected to each other, and it is important that they know the warning signs and alarming signs so that they can identify. But in many cases, it is pretty obvious. No suicide happens without giving a signal. And if we are aware about those signals, it would be possible to really identify and take them for treatment. What happens that the friends do not feel confident to intervene. There is a culture going around that it's not my business. And that culture needs to change. There has to be more association, more connection, more friendship, more more connection, and more discussion is the only way forward. So these are some of the important aspect of this identification. Yes.
Yeah, all right. Okay, so we also welcome questions, comments, the chat box if there are suggestions from other people for the sources. I have just one or two more questions related to the one I had. We have collected from different people, different students. One is about little bit tends to contact experts. I have heard the expression students the experts are useless. क्यों जाए हम उनके पास? उनको क्या पता? So somehow how we get, one is the student, they are thinking that way. One is of course the stigma is there. People are not talking about that. One is the reluctance, like how we can have that extra trust or of that between, so they feel comfortable talking to and approaching the system and the whatever is available.
So
will be for you, Dr. Shiv.
Problem is,
can you hear me?
Yes, I can.
Hello?
Yes, I can hear you. Can you hear me?
Yes, we can hear you. Yeah. Yes, go ahead, please.
Hello?
So as I said, the isolation and inability to connect is a major issue. There are ways to really break this cycle of feeling disconnected and not taking interest in friends and relatives. And one of the potentially effective method is to form a community after they land up in the city. Most of the time, they do not connect with each other is the fear that whether the other people will entertain or not. Now we also find that the community to live together is no more available. So everybody lives in different apartments in different places. And that really interferes in forming a friendship and a connectivity. So the way forward to really do something in this field is to see that the friendship takes place and they establish communication. So we'll have to find some common ground that after they arrive in the city, they know somebody and can establish connection amongst each other. Otherwise, the symptoms develop and it's not possible to really engage with them. Once the symptoms starts, the mindset changes and then it is very difficult to really connect with them. So identifying beforehand And after they arrive in the city, it's important that the college also should help to form a community of the student, which is culturally similar, so that they can be taken care of by each other's support. Yeah, so that's the way forward.
Okay, good. All right.
Rajesh,
So
if I could just make a comment here on something very important that has come up, and that is this idea of it's not none of my business. So I want to just bring forward to you, this happened with us 2 years ago in Montreal. There's a very well-known anesthesiologist who committed suicide, and people have been watching him for the last 6-8 months. He said, "Oh, he doesn't see, something's wrong with this guy. You know, he's not his usual self. You know." And you'd hear these comments in the corridor from people who knew him, but were afraid to ask, "Hey, what's wrong? Can I help?" And you know, he was a successful anesthesiologist in great practice, was a professor at McGill University, and he ended up committing suicide. And I think this tendency to say, you know, it's none of my business, is really to blame for that. Because if somebody would have took him aside, say, "Hey, you know, you don't look like your normal self. What's bothering you? Can we have a cup of coffee or have a drink and let's talk about it?" That might have saved that person's life. So when and this is to all the participants, everybody else, if you see somebody, you know, who you know in your friend circle or whatever, and they don't seem okay, it's absolutely okay for you to ask and get involved. You know, I think we have to be a bit more like in back home, where everybody knows everybody's business a little bit. You know, it's okay. It's not okay to say, "Well, it's not my problem, it's just their problem, they will deal with it, or the appropriate authorities will deal with it." You can really save somebody's life just by having a coffee and saying, "You know, what's wrong? Can we get to the bottom of this? Can I help you in some way?" So please, Dr. Srivastava's point is extremely valid and extremely valuable to everyone. Please pay attention to that and do get involved and not say, "Well, it's none of my business." You know, that's all. Thanks, Ajay.
okay. All right. So I have another student, Kuljit Kaur. I think you can unmute your things. I will have you next. Kuljit, are you there? So Kuljit came to Canada as a student to study the nursing. Let's see if I can get her on the. So she wants to say a few words. Let's see if we can get her online. If the technology works very well, she logged in using a phone. Kuljit, can you talk? Kuljit, are you there? I'll get her like that. Yeah, let's see. I don't know if she can get there. Through the phone is not working. Okay. All right. So let's go to the main points here. If she gets on, I'll have her experience as well. So we want to collect as many experiences from students in our next webinar. So what are the next steps? So I think some of you already mentioned that part, and we are also getting some comments. I'll read one or two comments in the meantime, and as well as the efforts by other associations like OFIC, Overseas Friends of India, Canada, that one as well, and the other associations. So in this case, the first one is we need enhanced awareness about various issues and how to overcome the stigma. It's not easy, but these are the major steps, the starting points for us. What should be the main focus of our next webinar? What should we talk about? We want to make it, this time was a little bit more just to open up the floor. People can talk about these things. We would like to hear from students or the people who have gone through as students, even if they are now young professionals. What are their experiences? What has happened? Cases and stories. And another important step, we would like to have maybe a comprehensive survey of the needs of these students. So right now, the priorities, this is such a vast field. We cannot do everything and anything even here. What are the major ones? What type of things would be there, should be the priority? Maybe that would help. Then on the website or the social media of the Sahyog, we would have the links, the resources, Canada-wide, different ones. So please feel free to share your resources, your links, your whatever other things you would have. And also forming partnership with different associations. There are different groups that are already there. They may have a different theme, different purpose now, but working together with other like-minded associations, nonprofits, whether they're in mental health issues or they are already entrenched into colleges and universities. So these are the other ones. I have one question we got from student, whether it falls into this category or not, maybe Dr. Shrivastava. Somebody saying, I am in Quebec City. Everybody speaks French. Actually, I'm in Montreal too. So in Quebec, they speak French. So the Indian students coming to Quebec in general, it's not just Quebec City. We have had that even whether it's Shas, other places. So the language barrier, and because of that, some issues. Is it related in this field? How would you answer to that? How to tackle this situation when we are feeling completely separated from the others because of the language barrier?
So I think it is one of the problem, which is isolation.
Yeah.
Now there are a couple of things which are important. I mean, in this case, there is no other option but to learn French. Nonetheless, when students start to migrate or come, they have to prepare from all angles. It is important that they prepare and try to find out what is the language spoken there and what kind of food is available, what kind of facilities are going to be available. So I think a much more elaborate message has to go to people back home. And secondly, the college has to take some significant responsibility. And if the local community can liaise with the college or the university, wherever they are coming for education, that they should have, and they normally have the in-house resource to see, if the student has the requisite skills or not. So if the local community can really discuss with the college and find out logistic that, hey, what is missing from Indian students' perspective? If there are some deficiencies in the college which is necessary for Indian students, then we may request that in what way the local community can help. But the deficiency needs to be plugged in for any kind of isolation which exists in the community and becomes a problem after the students arrive here. So that's the answer for this.
Okay, that's good. Thank you. I just want to it's in the group just posted by Mr. Shiv Bhaskar. There is another webinar organized by OFIC that will be December 19th. I think other people can see chat there. It's free of charge, and the speaker will be Dr. Owen Kelly, and then OFIC webinar is free. They're also providing counseling free of cost. So that is already there. So we want to work with different, all associations can come together. The cause is same in this case. So if you can have the last slide, last one, and then if there are other questions, comment, and if not, we'll close. So the one more, we are collecting all the resources. So if Anjana, can you change to the last slide? The last one more, what are whether it's South Asian therapy directory. So this is one of them, if we can have that resource available online, who can speak our language, Tamil, Telugu, Hindi, Punjabi, that kind of thing. The crisis line, suicide prevention services, other ones. As many others, so please go to our Facebook page, our Instagram, and we will have soon later on website as well for other resources. We will post this PowerPoint onto our Facebook page if you would like to have anybody, all the participants, anybody else. And then also further information will be available on our those two social media as well. So I wanted to ask Dr. Dwivedi, you would like to say final few words, if anything else, and then if not, I'll just close later on. Dr. Dwivedi?
Sure. I just want to thank all of you for being here with us and stress the fact that please make everyone in your contact group, your friends, aware of the resources that exist now to help them. And please help break the stigma. We need your help. to prevent any needless loss of life, and not even just loss of life, but also to help people out of depression, because this is a very significant problem, and it's going to only be tackled with everyone's participation. So thank you again to all our conferees, and thank you all for attending. Thank you for His Excellency Bisaria ji for making this with us. Thank you.
Okay, so from my side, thank you everybody here as well. But just a housekeeping one: if you still have questions, let us know. We will have, if not answered now, later on, and then we would be in touch with you. We would send out the final the link to our social media, whoever has attended that one. And thank you all the participants all the way from the beginning, and the Shalini as well. Special thanks to her for being so brave. And we had so many messages we saw on the chat, like everybody going, yes, it takes so much courage to talk about these things, and then the coming over the stigma and talking about these issues, being the advocate. And also special thanks to Anjana. She's working in the back room, kind of running the show for us. Thanks as well. And anybody else, do you have any final thought or words before we close? Do you want to say anything, Narendra Gargji? Are you, or who's there? And Shiv? Anybody? Okay, if not, all right. So anything else? Should we finish it, or any, Dr. Dwivedi?
No, I think we'll here. Does somebody else want to talk? No. I think we have to have a very special thank you for Professor Amresh Shrivastava. He's done a fantastic job. And thank you very much, sir, for this. It was very much appreciated.
No, my pleasure for this opportunity. Thank you very much.
Okay, thank you. We finished here. We still keep this thing open for some time. If there's somebody wants to write some comments or something, we can keep it open for another 20 minutes or so. But
I'll be happy to do that.
Yeah, that's fine.
So are there any questions, concerns?
That's good. All we answered. We took all of them. We did we read, we reviewed most of the ones. We added from the previous one, the discussion. So, and it happens to be the other webinar, and 19th is there in Ottawa. Or you would like to say something, Narendra Gargji? Who's there?
No, it's fine. I think you guys are doing an excellent job, and it is a very, very important topic which you guys have handled. So I really appreciate that. It should be extremely useful to all the students and Indians, especially the Indian students. So excellent job. Thank you.
Thank you. All right. Thanks a lot. Okay. All right. So we'll be around, but if not, I think we are probably done. Like, people have already started to go off. That's good. Thank you.
Thank you. Thank you very much.
Thanks, Al. We'll close it. We'll stop the recording now.
This